What does healthcare really look like on the front lines, especially in rural communities? In this episode of The Exam Room, we're joined by community health worker Joslyn Mikeworth from Canyonlands Healthcare. From connecting with hard-to-reach patients to bridging the gap between clinic and home, Joslyn shares what it takes to support patients beyond the exam room. We also explore how leadership shapes the frontline experience and why transparency, trust, and support can make all the difference for both staff and patients.
Welcome back to The Exam Room. Today we are joined by Joslyn Mikeworth, a community health worker at Canyonlands Clinic in Globe, where she is managing our diabetes patient education pilot. Joslyn brings a true frontline perspective to healthcare in a rural FQHC. She's served in multiple roles across the care team, giving her a deep understanding of both clinical workflows and patient realities. What stands out most to me is her passion for making sure patients feel supported, seen, and equipped with the resources that they need to succeed. In fact, several patients in our diabetes patient education program have told us they likely would not have finished the program without Joslyn's encouragement and guidance. Today we'll talk about what it's really like to work on the front lines of rural healthcare, the impact of leadership support or the lack of it, how CHWs engage and motivate patients, and what leaders can do to better empower their frontline staff. We'll also transition into lessons learned from the diabetes education pilot and what it shows us about the power of relationship-based care. Joslyn, welcome to the show.
Hi, Rhiannon.
Thank you so much for being here. Before we dive in, can you share a little bit about your journey in healthcare and the different roles you've held from MA to CNA to CHW?
So I started out as a CNA in a skilled nursing facility fresh out of high school. And from there, I went to work in Banner as a CNA, which I really enjoyed for a long time. And then I went to be a behavioral health medical assistant, which I also really enjoyed. And now I'm here as a population health worker.
Awesome. Well, we all know that frontline healthcare workers are really like that connective tissue of our health centers, right? Especially in rural communities. So, in the first part of our discussion, I want to explore what day-to-day life looks like on the front lines and how support from leadership shapes both staff experience and patient outcomes. And my first question for you to kick off the discussion is, can you share with us what a typical day looks like for you working on the front lines at a rural FQHC like Canyonlands?
So a typical day for me as a community health worker is honestly just reaching out to patients. That's just making those connections and making sure that they know that they have someone outside of who they think they have, like the MA, the provider. They have someone outside of that to support them in what they want and what they need. So it kind of it's bridging that gap between what you get from an MA, which is strictly like medical pretty much, and kind of bridging that gap between the clinic and home.
Yeah, I hear that engagement piece already coming through, and we'll get to more of that. What are some of the unique challenges of providing care and support in a rural setting like your FQHC?
A lot of the challenges are like just resources. Like we really struggle with getting patients into the clinic when we need to, and also just getting a hold of them. I feel like I can call 50 people in a day and 3 out of the 50 will answer, or I can send a bunch of messages and I'll only get a few responses. It's just trying to get a hold of them so that we can get them in or we can go see them.
So are there some techniques that you've found that help you overcome those barriers more frequently?
My biggest thing is just catching the patients when they're here. Like if I'm doing outreach to a certain group of patients, I pull a report every morning and have a discussion like with the providers, what patients are coming in and what they need and what they need from me specifically. So that really helps so they can kind of put a face to the name, like, who is this lady calling me all the time?
Mm. Mm-hmm.
And it gives me the opportunity to kind of go in there and explain what I'm doing and explain why I'm here. And I've noticed that that dramatically changes how they receive the information that I'm giving them.
Yeah, that makes total sense because if now you've introduced yourself and you've kind of gotten in front of them and had this conversation, hopefully when you call later or send them a message and they're like, oh yeah, Jocelyn, that amazing person I talked to at the health center. Yeah, that's so we've had previous conversations, you and I, about leadership and what support looks like. And you mentioned to me that the leadership at Canyonlands is really awesome and you feel really supported. What are some things that they're doing that other leaders listening to this could kind of take away from the conversation?
They're just honest and they're realistic about what they can and can't do. They set expectations and like not only what they expect of us, but what we can expect of them. And
Mm.
I feel like that makes a big difference. And then they're also just there. Whenever I need help, my manager, Camilla, she is always there. Like she thinks no question is stupid.
Mm.
She, I can come to her with the most stupid question and she is ready to just explain her way through it and help me. And I feel like that really is just how you can better support your staff is just being there.
Mm. Yeah, so some things that I heard from what you said is that transparency is a big deal, as well as support and just having that open door policy. Like you feel comfortable to go to your leadership with any questions that you might have. I know in the past there's leaders that I have had where I felt really comfortable doing that, and others where I didn't feel so comfortable doing that. And in some situations, with those ones that you do feel comfortable with, and this is the kind of leader I strive to be, is that whether it's a question or whether it's like, hey, I made a mistake, like this is what happened. And that they're going to help you work through it and not be like, you know, condemning, but they're going to come beside you and support you. And I think that's really important in my mind as well.
Yeah, and I feel like also listening to your staff, like when they come to you with a concern, instead of just giving excuses and being like, "Oh, I can't do this, oh, I can't do that." Tell them why. A lot of times when you're a frontline worker, your manager isn't the highest on the totem pole.
Mm-hmm.
There's someone above them that's telling them, "Oh, you can't do that." And when you have that transparency with your staff and be like, "Listen, I can't do this and this is why," it makes it easier to accept that. Like it's not, oh, my manager just doesn't care that I'm struggling. It's they can't do this because of this.
That's a really good point that you make as far as the organizational structure of most companies is like a top down. There's our front lines, and then there's our middle management, and then there's our upper echelons leadership. And what's at the top needs to trickle down to the bottom. I know when I worked for Pima Medical Institute, this is the only place I ever worked for that actually put out something called a scorecard, and they did that based on the benchmarks that we were concerned about, whether it was graduation rate, placement rate, attrition, all of those things, return on investment, net ROI, and all of these fun things. And there were 17 campuses, and we were all ranked on how we were doing in those areas. Quarterly, that came out. So that was transparency like I had never seen before. Plus, it brought out our competitiveness. We're like, what? So and so campus has got a 9 in this area, and we only have a 6. Yeah, we better step up our game so that whoever had the highest average across the scorecard got rewards. We got award for that, and some special things that leadership did for us.
I just feel like there's a good way to give constructive criticism and then there's a bad way. Like when you
Mm.
come to me and you just off the bat are just screaming at me, I'm not going to take that criticism very well because I'm just going to go on the defense because you're automatically just screaming. But when you're like, hey, like this is what's going on, this is what we need to do to fix it. Like is there anything I can support you in making this happen? I will take that a lot better than I will someone just coming at me screaming.
Absolutely. Have you had an experience where someone has come at you screaming? And if so, do you feel comfortable sharing that? Or
In a past position, I had a manager who was not very nice, and it wasn't just me that she treated like this, it was kind of all across the board. And one day we were short staffed and she was like, "Oh, you need to take your lunch at this time." But I had an opening in my schedule, so I asked her, "Would it be better if I take my lunch at this time so no one has to cover for me? Like, would that make it easier for you?" And she just off the bat, there were patients in the waiting room, was like, "You need to know your place. Like, you need to do as I say and not ask questions. Like, this is ridiculous. You just need to do what I'm telling you to do and not say anything back." And I was just like, what is going on? Why are you yelling at me, first of all? You could have just said, no, this is why I want you to do this. And it's inappropriate, especially in front of patients, because where I was, patients could see what was happening and hear what was happening. And it wasn't even just patients there. There were providers around and there was other staff around. And she just went off. She said some other things. I don't exactly remember. It was a while ago. I was just like taken aback because it was just so unprofessional.
yeah, I had a similar experience when I first started teaching, and I had took it upon myself to kind of reorganize our skills lab. And I had asked permission from my program manager if I could do that. And she said, yeah, sure, fine, whatever, do whatever. And so I did. I put some things where they shouldn't supposed to go, I guess, because we had this big like picture window that looked into the lab, which was a talking point for prospective students, right? Bring them by, they can look in the window, see the lab. Well, I put some equipment in front of the window, which I didn't know I wasn't supposed to do. And I had a room full of students, and she came in just like you said, yelling at me. What was I doing? And I couldn't do that, blah, blah, blah. It was horrifying because, like I said, I might have been there like 3 weeks teaching. I was totally new to the place and new to teaching. But I do have to say, she did come and apologize later. She bought the whole class pizza. She wrote me an apology note. She did never do that again. But, I think that for me, that repair part was really important. We're all going to make mistakes, and we're all going to have days where we don't perform our best or we don't act in the best way, but to kind of follow up. And so did the manager that you had, did she ever kind of try to mend the bridge at all? No.
No, so after that, I kind of just let it go and moved on, just was like, okay, like what, like I'll take my lunch when you said, like I won't put in my 2 cents anymore. Then at a later date, she did it again at a different location. I was working front desk at a clinic and she screamed at me there for my phone being out of my pocket. Like I wasn't on it, but it was like on the table. Again, she screamed at me in front of all the staff and all the patients. At that point, I was like, what is going on? Like why does she feel it's okay to do this? And then I again let it go. And then I saw her do it to someone else like a week later, again in front of patients, in front of staff. And that's when I was like, okay, this is getting ridiculous, and I went to her manager because I had spoken to her about it before. And he was like, okay, I'll take care of it. Like, she does not need to be speaking to you in front of patients or staff like that, or even in general, like even in private. It kind of just died out. Like, she never apologized. I never heard anything back from the manager. And that was ultimately why I decided to leave that position.
Sadly, I would venture to say that your experience isn't an uncommon one. What advice would you give to other frontline workers who might be listening, or to middle management or leadership about being in that situation? Like, let's just start with frontline workers. Like, if they're experiencing something like that, what advice would you give them?
They don't have to deal with that. No one deserves it. Like, even if you do make mistakes, you don't deserve to be screamed at for it in public and publicly shamed for it. And that you need to stand up for yourself. Like, yeah, you're at the bottom of the totem pole, but that doesn't mean that you deserve it. It doesn't mean that it's
Mm-hmm.
okay. Again, you need to stand up for yourself and make sure it doesn't happen again. Whatever that may mean, if that means having a conversation with your manager, and if that doesn't work, then you go above them. And if that doesn't work, you can always find another position.
Yeah, which is sad that it has to come to that. One thing that I think about is just knowing the policies and procedures of the health center and what that looks like. For me working in the OR, it was I'll call it an incident report, right? If something like that happened, and, all of us probably know this in healthcare, if it's not documented, it didn't happen. So
Yes.
at some point, that documentation piece, I think, can be really pivotal in advocating for ourselves, supporting ourselves. And every person in the health center, whether they're at the top or at the bottom or somewhere in the middle, they have a really unique role to fill, right? Like, you have special skills, like, let's be honest, that your CEO probably doesn't have. I think knowing your worth is a really important thing that you hit on there. And going through the process, using that chain of command, not being afraid to have those conversations and to advocate for yourself. I had a situation in the operating room. It didn't happen to me, I was witness to it, but I was working like a 2 to 10 shift, and I wasn't on call that night. And about 10 o'clock, we got a call from the OR supervisor, the nursing supervisor, saying, hey, that there's a case that's being added on. So the surgeon came wandering into the department, and I asked him if he had an extra pair of hands, somebody coming to help him. And he said no. And I said, okay, well, if you want, I can stay and help. And so I, kind of filled the role of the first assist. And then the surge tech that came in, she was scrubbing the case. The case was kind of a hairy one, and I'm sure he was under a lot of stress, and he had asked her for something, and then he asked her for something else, but she was trying to get the first thing, but he needed the second thing instead. And he grabbed her hand and, like, jerked her arm and, like, literally said, you need to pay attention to what's going on in the field. And her eyes got, like, as big as saucers, and, I thought she was going to cry. She didn't. She held it together. We finished the case, whatever. So the next morning I came in and I went to my boss's office and I wrote an incident report on it. And my friend was really upset at me for doing that, because she's like, well, he doesn't like me anyways, and now it's going to be worse. But it wasn't. It actually did help. So that can be scary, right? To speak out and to advocate for yourself. So we've talked a lot about what happens when support is missing, but can you share an example of, like, a specific example of when support was there and what that looked like in contrast?
I feel like when I started at Canyonlands, my manager just made sure. She was like, anything you need, like, we can message me anytime, whenever. And I feel like
Mm-hmm.
that was a big thing, because when I was first started, I struggled. Being a community health worker is so vastly different from being an MA or being a CNA. I feel like I was just reaching out to her all the time. She not once got angry with me. She not once did she just not want to help me. The staff at Canyonlands has been so supportive. Like, the other community health workers, we have one in Nevada. They're a lot up north in northern Arizona. And I can always, like, I know I can always reach out to them if I need help with anything. I guess another example of that is like when I was working at Banner. When I first started, we had like 2 or 3 CNAs call in sick. And at this location, we had an LPN, and the manager was able to get the LPN to step in. So I wasn't alone. So I was the only CNA on that unit. And we were able to get that LPN to step in and work as a CNA that night. So I wasn't alone. And that made the biggest difference.
Frontline healthcare workers like Joslyn play a critical role in connecting patients to care. But as we've heard, doing that work isn't always easy. In the next episode, we'll take a deeper look at the challenges happening behind the scenes, from workplace culture to moments where support falls short and how that impacts both staff and patient care. And in the final part of this series, we'll explore what change can look like, including advocacy, speaking up, and how stronger leadership and systems can better support the people on the front lines. Thanks for listening to The Exam Room.